As we get older, we can expect our bodies to age with us. Our hair, our hearing and vision, and general appearances all tend to take a hit. But what about arthritis? Is it unavoidable? Is there any way to lessen it if it does kick in, pain-wise? Dr. Michael Kim is here today to tell us about the latest products to help us take our bodies back. Good morning.
Good morning.
Thank you for being here.
Thank you.
Are there certain people within the society who are more susceptible to arthritis than others?
Well, in the thumb we're talking about this morning is very common, and it's mostly in women, actually. And the theory is because the ligaments are very lax in this joint, and over time they tend to wear out the cartilage. And basically, patients, you can see on the bottom right, have pain in that area, the bottom of the thumb, and it really hurts to pinch things, grab things, open jars, turn the key, and excruciating pain. Often starting in their 40s and 50s and progressing onwards.
And it can really be debilitating if you don't have full range of motion within your hands.
Oh yeah, I have patients say they can barely pick up a spoon to eat.
Oh my goodness.
So initially, the treatment of choice is cortisone shots and splinting, and that's of course controversial. But I'm very conservative, so I think if patients have pain in that area and it gets really, really bad, you need to come in and get a splint made and try to change the way you do things, ergonomics, and of course a cortisone shot, sometimes extremely. I've had patients get relief anywhere from months to years from a cortisone shot.
Really?
So
wow.
It's certainly worth a shot, and so after a shot and patients get better, we just watch them. But if they don't get better after a series of a couple of shots, then there is an operation that can be very helpful for the arthritis at the base of the thumb. And if you can see that initially what happens is, that's a saddle joint. The reason we have an opposable thumb is that joint goes in every direction. So we take the little bone out, as you can see that space on the x-ray where the bone was rubbing against, and we actually roll up one of your tendons. And that's the most common procedure. And we put it like a spacer, almost like an anchovy. I call it like a shock absorber, put it in there. And it really provides about 95% of my patients get relief of their pain completely after surgery.
On the slide there it says you spend about 2 weeks in a cast, but after that and some therapy, you get your life back or normal range of motion?
Yeah, but I'm very conservative because, there's a lot of downtime. You're talking 2 weeks in a cast, but you're talking 3 months of therapy.
Oh, wow, okay.
So it takes a long time to get that thumb back to normal. So I tell patients, this is really bad, you need to think about it, because that's a lot of inactivity without your thumb.
Especially if a cortisone shot would work, or at least temporarily fix you.
Right, I've given several physicians shots, and over the years, they can progress for over 10 years, it holds them over. So, but you shouldn't be suffering with it. Anti-inflammatories are helpful, some topicals, even some over-the-counter things like fish oil, some homeopathic medications, chondroitin sulfate, MSM, glucosamine. Those things sometimes can be helpful for arthritis.
And should you go right away as soon as you start to notice a problem and to a doctor?
I think, when it starts becoming where it really affects your activities of daily living, then you should talk to your family doctor, go see a hand surgeon like myself, and talk to him, get some x-rays, and maybe a cortisone shot, or maybe just some splinting and education. Usually that's the first step. I would definitely say do not jump right into surgery. You should try conservative management first. It's very important to try that because some patients can go on for the rest of their life without surgery.
All right, good to know. Thank you so much, Dr. Kim. As always, we appreciate it. You're watching Week News This Morning on WXCW.